Okay, good day everyone. So today we're going to have this science review, no, sa mga topic na ato anang na discuss, no. Also, there are videos ani, no. So for the full details sa on each topic, so you may watch the videos, no. So i-search lang na ninyo kana na mga topics, no. So i-search lang na disease affecting the sense organs, diseases and interest affecting the bones and muscles, and diseases affecting the stomach. So available ang mga videos sana, so pwede to ninyo tan-awon dito kini i-run lang nato siya. Okay, this is affecting the sense organs, no. We have the conjunctivitis, no, swelling and redness of the conjunctiva, no. So mao na siya ang conjunctivitis, no. So kana siya, no. No, next, a cataract is a clouding of the lens of the eye. So this is a cataract. Then common po na sa diba sa mga tigulang, no. A common ear disease for children is otitis media, no. It is a painful infection that cause a swelling of a portion of the middle ear. Now, tinnitus, no, can be described as the unusual ringing in the ears. No, sounds like the roaring, clicking, hissing, or buzzing. No, can be heard by the person affected by this disorder. So, cold, no, is an infection caused by virus which affects the nose and throat. No, this is very common, no, sa ato ang tanan, no. Cold, no. So na runny nose, magka-fever ta, no, and then the tongue, no, ang pinaka-strongest muscle sa ato ang body. Then we have learned that the common disease for the tongue is sores, or tinatawag na itong blisters. So common skin injuries are scratches, lacerations, and bruises, no. So next, this can be described as the unusual ringing in the ears. So ang tawagan niya tinnitus, no. So this can be described as the unusual ringing in the ears, no. This kind of disease is a result of abnormal growth of cells on the skin's epidermis. So that's what we call the skin cancer. Okay, these are wounds that go through the skin, no. This is often caused by sharp objects. So unsa may tawag na to so cuts or laceration, no, kanang maggamit og mga sharp objects, no, knife, scissors, no. Then accidentally masama nato tong kagalingon or masama nato sa atong kamot. Then next, what is the most common disease for the tongue? So tongue blisters, no, ang pinaka-common nga disease sa ato ang tongue. Okay, these are also given to a person with otitis media to lessen the earaches. So unsa may ginahatag kung nakay otitis media, of course, no, you will be given a person nga naay problema sa otitis media or naay otitis media, tagaan siya og pain relievers, no. It is a painful infection that causes swelling of a portion of the middle ear. So tawag nato otitis media. Okay, so okay, next, no, an infection caused by virus which affect the nose and throat, no. So ang tawagan niya cold, no, kanang magka-fever ta, sore throat, no. So okay, it is the swelling and redness of the conjunctiva, no, a thin layer of tissue over the sclera and the inside of the eyelids. So tawagan na niya conjunctivitis, no. So kana siya, no. Next, no, if you have a conjunctivitis, what is the best thing to do? So ang pinaka-nindot buhaton is you have to visit a doctor, no, to determine first its cause. So sa doctor ka, no, mangutana, no. So a cloud of the lens of the eye, no, this makes people with cataracts see through their cloudy lenses like a fog up window. So ang cataract, no, so cataract nung. So here now we go with the diseases and injuries, no, affecting the bones. So fracture, no, so we have know that fracture happens when a bone is subjected to strong force, no, which causes it to break, no. So nabanggaan, no, accidentally nabanggaan og motor. So magkakuan na sa fracture or nakuan sa hagdanan, no, nahulog sa hagdanan, no, or ini na mga makakuan, no, makahatag og fractured, no, sa ini activities, no, or ini objects nga malabog sa kuan or kung asa ba, no. Not all accidents may lead to the breaking of the bone. So some injuries, no. So dili tanan, no, sa may lead to the breaking of bone. Ang uban dislocation lang, no, ma-dislocate lang ang bone, no. So ang sprain pod, no, injury to the ligament which is a stretch turn, no. So osteoporosis, no, bone disease, no, that is very common to elderly people, no. So na magkanipis ug magka-weak tong iyang mga bones, no. So na-advertise ana nga unlean lagi daw, no. So imno, no, para mo strong ang bones. And then arthritis, no, another sickness common for elderly people, no. So kana siya another pud na siya nga nga common nga ma-encounter sa mga elder people, no, sa mga tigulang na. And then ang kuana na, no, swelling of the joints, no, which may cause pain, stiffness, and ma-reduce ang ilang ability to move. Then ang rickets, bone condition that is usually observed in children, no, labi na kung kulang or lack of calcium and vitamin D. Ang strain naman po, no, so mao na siya ang tear in the muscle or the tendon. Ang cramp, involuntary construction of muscles that do not relax, no. So we have learned that ang cramp po dili ko sa ingon nga length, ang length niya nga masuffer nimo sa dili ko ingon nga taas, no. Then we have the muscular dystrophy where hereditary siya, no, from one generation to another generation or gikan pa sa kanunuan, no. Nasa na siya nga disease, no, masen siya nga mga disease dito sa mga apo-apo, no. Then the poliomyelitis or the polio, no. So kana siya caused by polio virus, no, nga kung asa gina-attack ang spinal cord cells, no. So mo nang magka-deform, mo deform ang mga porma sa tiil. It is a break in the bone, no. So fracture. Okay, a bone disease that is very common to elderly people, no. So osteoporosis, a sudden involuntary contractions of muscles that do not relax. So tawagan na niya cramp. It is a condition brought by calcium and vitamin D. So rickets. So an injury to the ligament when it is stretched or torn. So tawagan na niya sprain. It is the swelling of the joints which may cause pain, stiffness, and reduced ability to move. Arthritis, no. So sa mga tigulang po, no, sa mga older person po, no, it is the thinning and weakening of the bones which can result to painful fractures, no, osteoporosis. So a bone condition that is usually observed in children, rickets. It is an example of a hereditary disease, which means it may be passed from one generation to another. Muscular dystrophy. This is a very painful muscle condition that lasts only for few minutes. So cramp. No, so diseases affecting the stomach and intestines. So these are the diseases that may affect our stomach and intestine. No, we have hyperacidity, diarrhea, where makuha na to sa pagkaon na to sa mga contaminated food, gastroenteritis, no, so stomach flows, no, or gastroenteritis, no, and then constipation, no, which is the opposite of diarrhea, no, kanang irregular or infrequent bowel movement that are hard to pass, no. Then we have also the indigestion or this dyspepsia, then the appendicitis, no, inflation of appendix, no, small children. And then we have the cancer, no, colon cancer. No, so let's proceed. No, a result of having too much acid in the stomach, no, that may result to hyperacidity. No, kung too much acid ang nasa imong stomach, to result na siya dito sa hyperacidity. So the frequent movement of loose and watery bowel. So tawagan na niya diarrhea. So this is also known as stomach flu, no? Is a severe kind of diarrhea, no? So we have the gastroenteritis, no? So what is the opposite of diarrhea? So the opposite of diarrhea is constipation, no? So the irregular common cause of the sickness is having a poor diet and less water in the body. So what is the cause of having a diarrhea? So eating contaminated food, no, which is prone to having bacteria. So which of the following is the best thing to do to avoid dehydration when one has diarrhea? No, to avoid dehydration, no, you have to drink plenty of water, no? So kinahanglan ta mo drink of plenty of water. It is the inflammation of appendix, no, a small tube that extends from the large intestine. So we have the appendicitis. This condition is the irregular or infrequent bowel movement that are hard to pass. So constipation, no. So what is the most effective way to improve digestion? No, to improve your digestion, kinahanglan taog, we have to hydrate, no, our body with water. Which organ is affected when someone has a hyperacidity? So ang stomach, no? So ang stomach ang una gid na mag-suffer na ang una maigo, no? So thanks for watching and God bless.